Welcome back, everyone, for another deep dive. Today, we've got an interesting collection of stuff from medical journals and studies on this really important topic, the early detection and management of mental disorders.
Yeah.
We're going to be looking at schizophrenia,
Okay.
eating disorders,
Yeah.
anxiety disorders, depression, and even Alzheimer's disease.
Wow, that's a lot to cover.
It is, but it's all about recognizing those early signs so we can get people the right treatment.
Right. And that early detection is really key for effective treatment and better outcomes for these conditions.
Exactly. So today we're going to dive deep into these sources and uncover what they reveal about recognizing those early signs and how understanding those signs can lead to better outcomes.
Yeah.
And you might be surprised to learn that some seemingly normal childhood traits could actually be early indicators of certain conditions.
Oh, that's fascinating. Yeah. Some of those signs can be hidden in plain sight.
Exactly. So let's start with schizophrenia. Um, I know that's a condition that's often really misunderstood. So where do we even begin when we're talking about early detection?
Well, you might be surprised to learn that in the years leading up to a schizophrenia diagnosis, many people experience these subtle changes in their mood and behavior,
Okay.
like social withdrawal or a lack of motivation. And it's not always the dramatic hallucinations we typically associate with the condition.
Right. So you're saying it's not always as obvious as we think?
Yeah.
That is surprising. So you're talking about the prodromal stage, right? That period before the psychotic symptoms that we more typically think about with schizophrenia?
Exactly. And a study called the ABC Schizophrenia Study actually followed individuals over time and found that 73% of those who developed schizophrenia had experienced this prodromal stage.
Wow. So it's actually really common.
It is. It is. And what's fascinating is only a small percentage, about 6.5%, started with what we call those more obvious positive symptoms like hallucinations. Most experienced kind of subtler negative symptoms for a prolonged period, sometimes years, before psychosis even emerged.
Oh, wow. So it's almost like a slow burn with these subtle shifts happening below the surface before anything really obvious happens.
Yeah, that's a great way to put it.
And researchers have found that the longer this prodromal stage lasts and the more severe those negative symptoms are, the more challenging the course of the disorder can be.
Right, that makes a lot of sense.
So how can we actually recognize these early signs if they're so subtle and can be so easily mistaken for other things?
That's the million-dollar question, and that's why early detection is just so crucial.
Yeah.
And researchers use a tool called the ERO symptom list to try to track some of these early warning signs.
Okay.
It covers a really wide range of symptoms from, mood changes and anxiety to more concerning signs like unusual thoughts and even perceptual disturbances.
So is this something that clinicians use to track all the potential indicators?
Yeah, they use it to track these potential indicators. But it's important to remember that many of the most frequent symptoms on this list are what we call nonspecific,
Okay.
meaning they can be found in a lot of different contexts.
Right.
Things like, loss of energy and difficulty concentrating and social withdrawal. These can be signs of many things, not just schizophrenia.
So how do we differentiate between, typical teenage angst and something more serious?
That's a great question.
Yeah.
It's really about looking at the bigger picture, considering the individual's functioning overall.
Okay.
So are they struggling to keep up with school or work? Are they withdrawing from friends and family? Are these changes persistent and really impacting their daily life? Those are the kinds of questions we need to be asking.
So it's really about recognizing patterns and connecting the dots,
Exactly.
not just looking at these isolated symptoms.
Exactly. And this is where early intervention becomes just so important.
Yeah.
If we can engage individuals and their families before crisis occurs, before those more severe psychotic symptoms even emerge, we can potentially change the trajectory of the illness.
I can definitely see how that early intervention could be impactful. What does that kind of intervention actually look like?
Well, it can vary, of course, depending on the individual's needs, but often it'll involve things like individual therapy, family therapy, and even medication if necessary.
Okay.
Support groups and what we call psychoeducation can also be extremely helpful.
And what is psychoeducation exactly?
It's where individuals and families learn about the illness and how to manage it.
Okay, so really giving them the tools.
Yeah, giving them the tools and the information they need.
That makes sense.
And it's really about empowering individuals and their families to take an active role in their recovery journey.
Right, and it sounds like the more we know about schizophrenia, the better we'll be able to support people.
Absolutely.
Now, we've been talking about the prodromal stage and early intervention, but there's also a lot of talk about individuals who are considered ultra high risk or UHR for developing psychosis.
Right.
Can you explain what that actually means?
Yeah, so when someone is showing a number of these early warning signs, we talked to the EI Rouse list,
Yeah.
they are considered UHR for developing psychosis,
Okay.
which could indicate schizophrenia or other psychotic disorders.
Okay.
Basically, it means they meet certain criteria that indicate a significantly elevated risk of transitioning to psychosis.
So they're not experiencing psychosis yet, but they're showing signs that they might be on that path.
Exactly.
Okay.
And these signs can include things like subthreshold psychotic symptoms.
What does that mean?
They're basically like milder, less intense versions of the hallucinations and delusions we see in full-blown psychosis.
Okay, so not full-blown hallucinations, but maybe some unusual perceptual experiences or odd thoughts.
Yeah, exactly. And another sign is what we call brief intermittent psychotic symptoms.
Okay.
And that's where someone might have these fleeting moments of psychosis that come and go.
So it's not constant, but it's still something to be concerned about.
Absolutely. And then there are also genetic risk factors,
Right.
like having a close relative with schizophrenia.
That can increase someone's risk.
Yeah, it does increase an individual's risk, but of course, it's not a guarantee.
Of course. Of course. So family history plays a role, but it's not the only factor.
Right.
What are the ethical considerations when identifying someone as UHR? I feel like there's a really delicate balance between trying to help and potentially causing harm.
You're right. It is a sensitive area.
Yeah.
One of the most important considerations is making sure that participation in any early intervention program is completely voluntary and based on informed consent.
Right. So people really understand what they're getting into.
Exactly.
Okay.
Individuals need to understand the risks and benefits and choose to participate without any pressure.
So it's about empowering individuals to make informed decisions about their own mental health care.
Absolutely. Yeah.
That makes a lot of sense.
And it's also important to acknowledge the limitations of what we know right now.
Right. We're still learning.
Yeah, we are. We're still learning and evolving in this field. We can't predict the future with certainty.
Just because someone is identified as UHR doesn't mean they're definitely going to develop psychosis.
Right, and we don't want to create unnecessary anxiety or stigma.
Exactly. It's about finding that balance between offering support and being mindful of the potential impact of labeling someone as potentially sick when they might never experience those challenges otherwise.
Right, so we want to be cautious but also hopeful.
Yes.
That's a really important point.
Yeah.
So while there's a lot of hope surrounding early detection and intervention, it's crucial to approach this work with caution and sensitivity.
Absolutely.
Now let's move on and explore some of the other mental health challenges you included in this deep dive, starting with eating disorders.
Okay.
What are some of the things we should be looking for there?
Well, eating disorders, particularly anorexia and bulimia, can be really tough to detect early on
Okay.
because they often involve a lot of secrecy and shame.
Right.
But some childhood personality traits and behaviors could actually be early indicators.
Okay, I'm intrigued. What kind of traits are we talking about? So for anorexia, think of the good child, the one who's always striving for perfection,
Yeah.
who might be introverted, very rigid in their thinking, and a bit of a perfectionist.
Oh, so those traits, while seemingly positive on the surface, could actually increase the risk of developing anorexia.
Yeah, they can, especially when coupled with the societal pressure to be thin.
It's like creating the perfect storm.
Exactly. And we also see behavioral patterns like excessive activity and even picky eating in early childhood.
Wow.
That could be potential indicators.
So even in childhood, there might be these subtle hints
Yeah.
that could point to a higher risk of developing an eating disorder
Right.
later on.
Right.
What about bulimia? Are there any early signs or risk factors associated with that?
With bulimia, we often see a history of chronic dieting.
Oh, so that cycle of restricting and then overeating.
Exactly.
Okay.
And family history can also play a role.
How so?
Well, if there's a family history of overweight or mood disorders or even substance abuse, that can increase the risk of developing bulimia.
So it's this really complex interplay of genetic predisposition and environmental factors all coming together.
That's right. And the tricky part is that dieting itself is so normalized in our culture
Yeah.
that it can be really hard to distinguish between what's considered, healthy weight management
Right.
and what might be a warning sign.
That's a great point. It's like we're almost conditioned to ignore some of those early warning signs because they're so ingrained in our society.
Exactly. And that brings us to another area where early detection is often missed, Anxiety disorders.
Yeah, anxiety disorders are so prevalent these days, and yet it seems like they often go undiagnosed or misdiagnosed.
Right.
What are some of the key things we need to be aware of?
Well, first and foremost, we need to remember that anxiety disorders aren't just a phase or something people can simply snap out of.
Yeah.
They're real, often chronic conditions that really require attention and treatment.
So not just everyday worries or nerves, but something much more persistent and debilitating.
Exactly. And the sooner we can intervene, the better the chances of preventing long-term suffering and disability.
So early intervention is really key.
It is.
What are some of the red flags that might indicate that an anxiety disorder is developing?
Well, there are various types of anxiety disorders, each with its own set of symptoms and challenges.
Oh.
Generalized anxiety disorder involves excessive worry and tension, often about everyday things.
Okay.
Panic disorder is characterized by sudden and intense episodes of fear. We call them panic attacks.
Right.
Social anxiety disorder involves fear and avoidance of social situations.
Okay.
And post-traumatic stress disorder can develop after experiencing or witnessing a traumatic event.
So a really wide range of experiences can fall under the umbrella of anxiety disorders.
They do.
What are some of the early signs that, parents or teachers or even friends might notice?
Well, it really can vary depending on the type of anxiety disorder.
Yeah.
But some common signs are excessive worry or fear that seems out of proportion to the situation. Avoidance of certain activities or places.
Yeah.
Physical symptoms like a racing heart or difficulty sleeping, changes in appetite, things like that.
So it's not just about the emotional experience of anxiety, but also those physical and behavioral changes that can go along with it.
Exactly. And these signs can often be mistaken for other things,
Yeah.
especially in children and adolescents.
Yeah. How so?
Well, a child who's anxious might be perceived as just shy or clingy,
Right.
while a teenager who's struggling with social anxiety might just be seen as moody or withdrawn.
So we really need to look beyond the surface and consider those underlying causes of the behavior.
Yeah, we do.
What role does early childhood temperament play in the development of anxiety disorders? Could a child who's naturally more anxious be more likely to develop a full-blown anxiety disorder later on?
That's a really great question.
Yeah.
Research does suggest that temperament can play a role.
Okay.
Children who are naturally more inhibited or fearful,
Yeah.
they might be more susceptible to developing anxiety disorders.
Okay.
But it's not a destiny.
So it's not just nature, it's also nurture.
Exactly.
How a child's environment and experiences can either, exacerbate or mitigate those innate tendencies.
Precisely. A supportive and nurturing environment can really help a child develop coping mechanisms and build resilience, even if they have a more anxious temperament.
Right. So how they're raised and the environment they're in can make a big difference.
Yeah, it can. Conversely, a stressful or traumatic environment can increase that risk of developing an anxiety disorder.
That makes a lot of sense.
Yeah.
It makes you wonder if there are things that parents and caregivers can do to foster resilience in their children.
Oh, absolutely. Creating a safe and predictable environment, teaching children how to manage their emotions,
Yeah.
and modeling those healthy coping mechanisms.
Right. Leading by example.
Exactly. That can all make a huge difference.
That's great advice. What about early detection in primary care settings? It seems like anxiety disorders are often missed there. Why is that?
Well, it's complicated. Sometimes the symptoms of anxiety are masked by other physical complaints. So, patients might focus on headaches or stomach aches
Right.
without realizing that those could be linked to anxiety.
Right. They might not even make that connection.
And some people might just be reluctant to talk about mental health concerns, especially in a primary care setting where they're used to talking about physical health issues.
Right. It's like there's still a stigma attached to mental health, even though we've made some progress in recent years.
Right. There is.
What can we do to address that?
Well, I think we need to normalize conversations about mental health.
Yeah.
It should be just as routine to ask about anxiety and depression as it is to ask about blood pressure or cholesterol levels.
So integrating mental health screenings into those routine checkups
Exactly.
could be a game changer.
It could. And we also need to educate healthcare providers
Yeah.
about the signs of anxiety disorders so they're better equipped to recognize them.
So it's about making mental health care a priority and not an afterthought. Now let's talk about depression, another condition that's often misunderstood and misdiagnosed.
Yeah.
Depression is so incredibly common, and yet it's often missed, especially in primary care settings.
It is, and it's not always as straightforward as just feeling sad or down. It can manifest in so many different ways.
Right. It's not just about that emotional experience, but also the physical and behavioral changes that can accompany depression.
Exactly. Someone with depression might experience fatigue, changes in sleep or appetite, difficulty concentrating, loss of interest in things they used to enjoy,
Yeah.
even physical aches and pains.
So many different symptoms that could easily be attributed to other things.
Absolutely. And sometimes people might not even realize they're depressed. They might just feel like they're in a funk or going through a rough patch.
Right. It's like they're living under a cloud, but they don't even know the cloud is there.
Exactly.
What are some of the challenges in diagnosing depression in primary care settings?
Well, one challenge is that patients might not present with the classic symptoms of depression.
Yeah.
Instead, they might focus on physical complaints, like headaches or fatigue.
Okay.
This is known as somatization, where emotional distress is expressed through physical symptoms.
So they might be seeking help for those physical symptoms without realizing that there's an underlying mental health issue.
Exactly. And that's where the primary care physician needs to be really attuned to those subtle clues.
Yeah.
Asking the right questions, listening carefully to the patient's concerns, and recognizing that those physical symptoms might be a manifestation of something deeper.
So it's like being a detective, piecing together those clues to figure out what's really going on.
Precisely. And another challenge is that depression can be difficult to distinguish from other conditions like anxiety disorders or even medical illnesses.
Right.
It's not always a clear-cut diagnosis.
So a comprehensive assessment is really crucial,
Yeah.
considering all those potential factors that could be contributing to the individual symptoms.
Exactly. And you mentioned somatization earlier,
Mhm.
where people experience physical symptoms as a manifestation of emotional distress.
Yeah.
That could be a particularly tricky thing to detect.
It can, because the physical symptoms are real. The person isn't faking it. They're experiencing genuine pain or discomfort. But the root cause is psychological, not physical.
Exactly.
So it's about understanding that mind-body connection, recognizing that our emotional state can really impact our physical health.
Absolutely. And it's important to note that somatization is not a conscious choice.
Right. It's not something people are doing on purpose.
Exactly. It's a subconscious process where the body is expressing emotional distress in a physical way.
So how do we approach treatment when somatization is involved? Is it a matter of addressing both the physical symptoms and the underlying emotional issues?
Yeah, it requires a multifaceted approach.
Okay.
And first and foremost, it's important to validate the person's experience. Their pain is real.
Yeah.
It needs to be acknowledged. But we also need to help them understand the connection between their emotional state and their physical symptoms.
So helping them see the bigger picture,
Exactly.
that their mind and body are so intertwined.
Right. And then we can start to address the underlying emotional issues through therapy, stress management techniques, other coping strategies.
So it's about empowering them to manage their emotional health, which can then have a positive impact on their physical health.
Exactly.
Now, let's move on to another challenging area, Alzheimer's disease. Alzheimer's disease is a progressive neurodegenerative disorder that affects memory, thinking, and behavior.
Right.
And while there's currently no cure,
Yeah.
early detection is really crucial for managing symptoms and planning for the future.
It is. Yes.
So it's about maximizing quality of life for as long as possible.
Exactly. And there's growing interest in identifying individuals who are at risk for developing Alzheimer's even before they start showing those noticeable symptoms.
Okay.
And this is known as preclinical Alzheimer's disease.
So we're talking about detecting these subtle brain changes that might signal the disease is developing even before those changes have really impacted the person's cognitive abilities.
Exactly. And there are a number of different assessment tools and biomarkers being used to try to identify individuals at risk.
What are some of those?
Well, there are things like memory tests,
Okay.
neuroimaging techniques,
Yeah.
and even genetic testing.
Wow, so it's like looking for those early warning signs, those subtle hints that something might be off.
Yeah, it is.
Can you talk about some of those assessment tools and biomarkers in more detail?
Sure, one that's commonly used is called the Mini Mental State Examination, or MMSE,
Okay.
which is basically a brief questionnaire that assesses various cognitive functions, including memory, attention, and language.
Okay.
Another tool is the Montreal Cognitive Assessment, or MoCA, which is a bit more comprehensive than the MMSE,
Okay.
and it's particularly sensitive to mild cognitive impairment.
So these are tools that clinicians can use to get a snapshot of the individual's cognitive functioning.
Exactly. And then there are neuroimaging techniques such as magnetic resonance imaging, or MRI,
Right.
which can detect structural changes in the brain that might be indicative of Alzheimer's disease.
Yeah.
Another imaging technique is positron emission tomography, or PE,
Yeah.
which can measure brain activity and detect areas of reduced glucose metabolism, which is another hallmark of Alzheimer's disease.
So these imaging techniques provide a more detailed look at the brain and help us see what's happening beneath the surface.
Precisely.
And then there's genetic testing.
Right.
A specific gene called APOE4 has been linked to an increased risk of developing Alzheimer's disease.
Right.
So if someone has this gene, does that mean they're guaranteed to develop Alzheimer's?
Not necessarily. It's just one piece of the puzzle.
Yeah.
Having that APOE4 gene increases the risk,
Yeah.
but it's not a definitive predictor. And even people who don't have this gene can still develop Alzheimer's disease.
So it's about understanding the individual's overall risk profile, right?
Yeah.
Considering their genetic predisposition, their family history, and their lifestyle factors.
Yeah, exactly.
Now, you mentioned that early detection is crucial for managing symptoms and planning for the future. Can you elaborate on that? What are the benefits of early detection?
Well, one benefit is that it allows individuals and their families to make informed decisions about their care and their future.
Okay.
They can start making plans for their finances, their living arrangements, and their legal affairs,
Right.
while they're still cognitively able to do so.
So it's about taking control of the situation and making choices while they still have the capacity to do so.
Exactly. And early detection also allows for earlier intervention.
Yeah.
While there's no cure for Alzheimer's, there are medications that can temporarily slow the progression of the disease and help manage symptoms.
So it's about maximizing quality of life for as long as possible, even though the disease is ultimately progressive.
That's right. And early intervention can also involve lifestyle changes, such as regular exercise, a healthy diet,
Right.
cognitive stimulation, which can help maintain brain health, and slow cognitive decline.
So it's not just about medication, it's about adopting a holistic approach
Absolutely.
that addresses all aspects of the individual's well-being. Now, let's talk about the challenges of early detection in Alzheimer's disease.
Yeah.
What are some of the hurdles we face in identifying individuals who are at risk before they start showing noticeable symptoms?
Well, one challenge is that the early signs of Alzheimer's disease can be really subtle
Yeah.
and easily mistaken for normal age-related changes.
Right. Like everyone forgets things sometimes.
Exactly. Forgetting appointments, misplacing items,
Yeah.
having occasional difficulty finding the right word. This can happen to anyone,
Especially as we get older.
especially as we get older.
So it's about differentiating between what's considered normal aging
Right.
and what might be a sign of something more serious.
Exactly. And that's where a thorough assessment by a qualified healthcare professional is crucial.
Yeah.
They can gather information about the individual's medical history, their family history, their current symptoms,
Right.
their overall cognitive functioning to determine whether further evaluation is warranted.
So it's about looking at that bigger picture, considering all the potential factors that could be contributing to the individual's cognitive changes.
Precisely. And another challenge is that there's still a lot of stigma associated with Alzheimer's disease.
Right. People might be afraid to even talk about it.
Exactly. People might be reluctant to seek help because they're afraid of the diagnosis,
Yeah.
or they might worry about the impact it'll have on their family and their social life.
So it's about breaking down those barriers,
Yeah.
creating a more open and accepting environment where people feel comfortable talking about their concerns and seeking help when they need it.
Absolutely. And that's where education and awareness are so important.
Right.
We need to educate the public about those early signs of Alzheimer's disease.
Yeah.
Encourage people to seek medical attention if they're experiencing any kind of cognitive changes.
So it's about empowering individuals to take charge of their brain health,
Exactly.
just like they would with any other aspect of their health.
Absolutely.
Now, we've talked about a lot of different mental health challenges,
We
from schizophrenia to eating disorders to anxiety disorders to depression to Alzheimer's disease.
Yeah.
It seems like there's a common thread running through all these discussions, and that's the importance of early detection.
You're absolutely right. Early detection is just crucial across the board.
Yeah.
It's about recognizing those potential warning signs, seeking professional help when needed, and intervening early to maximize the chances of a positive outcome.
So it's about being proactive, not reactive,
Exactly.
when it comes to mental health.
And it's about recognizing that mental health is just as important as physical health,
Yeah.
and that it deserves the same level of attention and care.
Now, we've covered a lot of ground in this deep dive.
We have.
And it's clear that early detection is a really complex and multifaceted issue.
It is.
But there's one question I keep coming back to.
What's that?
How do we identify those early signs in children,
Right.
especially when those signs might be masked by behaviors that we might simply attribute to a child being difficult?
That is a great question. And it's one that parents, educators, and healthcare providers grapple with all the time.
I bet.
It's important to remember that children, especially young ones,
Yeah.
they don't always have the language or the emotional maturity to express their feelings directly.
Yeah, they don't always know how to tell us what's wrong.
Exactly. So their distress can manifest in behaviors that adults might perceive as difficult. Things like tantrums, defiance, aggression, withdrawal.
So it's like their behavior is a form of communication, a way of signaling that something's not right.
Exactly.
That makes a lot of sense. So how do we actually decipher those signals? How do we differentiate between a child who is simply going through a phase and a child who might be struggling with a mental health issue?
A good question. And it's about looking for patterns and changes in behavior.
Okay.
Is this a sudden shift, or has this been an ongoing thing? Is the behavior interfering with the child's daily life, their relationships, their schoolwork, their ability to function at home?
So it's not just about the intensity of the behavior, but also its duration and its impact on the child's overall well-being.
Exactly. It's also crucial to consider the context.
Okay.
Has the child experienced any recent stressors or traumas?
Right.
A move, a divorce, a death in the family?
Yeah.
Are there any issues at school or with their peers?
So understanding the child's environment and their experiences
Right.
can provide those valuable clues about what's at the root of their behavior.
Absolutely. And while some level of difficult behavior is completely normal in childhood,
Of course.
there are certain red flags that should always be taken seriously.
Like what, for instance?
If a child is expressing thoughts of harming themselves or others, that's an immediate cause for concern.
Right.
Similarly, if they're engaging in self-destructive behaviors, cutting, substance abuse, eating disorders, those are serious issues that require professional help.
Yeah, those are definitely some alarming signs.
Yeah.
What about less extreme but still concerning behaviors? What should parents be watching for?
Well, significant changes in sleep or appetite, persistent sadness or withdrawal, extreme anxiety or fear, sudden drops in school performance, difficulty concentrating,
Yeah.
frequent physical complaints like headaches or stomach aches. These are all signs that something might be amiss.
So it's about noticing those changes in the child's baseline,
Right.
those deviations from their typical behavior and mood.
Exactly. And it's about trusting your gut as a parent or caregiver.
Yeah.
If you're concerned about a child's behavior, don't hesitate to reach out for professional help. It's always better to err on the side of caution.
I agree. What are some good resources for parents who might be concerned about their child's mental health? Where can they turn for help?
Well, the child's pediatrician is always a good starting point.
Okay.
They can assess the situation and make referrals to specialists if needed.
Great.
School counselors are also a really valuable resource.
Yeah.
And there are a lot of excellent mental health organizations that provide information, support, and referrals to qualified professionals.
Are there any that you recommend?
The National Alliance on Mental Illness, NAMI, is a great place to start.
Okay, great. So there is help out there. It's just a matter of knowing where to look and feeling empowered to reach out.
Exactly. And it's important to remember that seeking help for a child's mental health is a sign of strength, not weakness.
Yeah.
It's an act of love and advocacy.
Well, I think that's a perfect note to end on. This deep dive has been so informative, albeit a bit overwhelming at times.
It's a lot to take in.
It is. We've covered so much ground, from the intricate complexities of schizophrenia to the subtle warning signs of eating disorders,
Right.
from the pervasive nature of anxiety disorders to the silent struggles of depression, and even that daunting reality of Alzheimer's disease.
It really is a testament to the breadth and depth of the human experience and the huge impact that mental health has on all of our lives.
Absolutely. But amidst all of the complexities and challenges, there's also this glimmer of hope.
There is, and that hope lies in our growing understanding of these conditions, our evolving approaches to treatment, and our unwavering commitment to early detection and intervention.
It's about recognizing that mental health is just as important as physical health, and that seeking help is not a sign of weakness, but a sign of strength.
Beautifully said.
So to our listeners, thank you so much for joining us on this journey of discovery.
Yeah, thanks for listening.
We hope this deep dive has empowered you with knowledge,
Yeah.
sparked your curiosity, and perhaps even inspired you to be a more informed and compassionate advocate for yourself and others.
Absolutely.
Remember, early detection is not just about identifying those symptoms, it's about recognizing potential. The potential for growth, for healing, and for living a full and meaningful life, regardless of the challenges that we face.
That's a great point.
Until next time, keep exploring, keep learning, and keep diving deep.
See you next time.
It's interesting because we talk about these early signs and these risk factors,
Yeah.
but how do we actually know when it's more than just, normal teenage angst or just a difficult period?
That's a great question, and it's one of the biggest challenges in early detection
Yeah.
because these signs can be subtle and easily misinterpreted.
Right.
And with depression in particular, there's this added layer of complexity.
Okay, how so?
Well, depression often presents differently in teenagers than it does in adults.
Okay.
So while adults might experience that classic sadness and hopelessness,
Yeah.
teenagers might be more likely to exhibit irritability, anger, or even rebellious behavior.
So those mood swings and that acting out could actually be a sign of depression.
Exactly, and it's easy to misinterpret those behaviors as typical teenage angst or even defiance.
Right, because those are pretty common teenage behaviors anyway.
Exactly, and that's why it's so important to pay attention to the context and the duration of these behaviors.
Okay, so what should parents and educators be looking for?
Well, one thing is to look for changes in the teenager's usual behavior. Are they suddenly withdrawing from friends and activities they used to enjoy? Are their grades slipping? Are they having trouble sleeping or eating? Are they expressing feelings of worthlessness or hopelessness? These could all be red flags for depression.
So it's about noticing those shifts in their baseline, those deviations from their normal patterns?
Exactly, and it's also important to create an environment where teenagers feel comfortable talking about their feelings.
Yeah, that open communication can make a big difference.
It can let them know that it's okay to not be okay and that there's no shame in asking for help.
Now, you've also mentioned this concept of masked depression, where the symptoms are hidden behind other issues.
Right.
Can you explain that a little more?
Sure, sometimes depression manifests in ways that don't fit the typical picture.
Okay.
For example, a teenager might complain of physical symptoms like headaches or stomach aches,
Yeah.
or they might engage in risky behaviors like substance abuse or self-harm.
Okay.
These behaviors could actually be a way of coping with underlying emotional pain.
So it's like those behaviors are a mask
Exactly.
concealing the true issue.
And it's why it's so important for healthcare providers to beware of these atypical presentations of depression and to ask the right questions to uncover what's really going on.
That makes sense. It's like being a detective again, right? Trying to piece together the clues.
Exactly. And early detection is key in these cases because the sooner we can identify and address the underlying depression, the better the chances of preventing those negative consequences.
Now, let's shift gears a bit and talk about Alzheimer's disease,
Okay.
which you mentioned earlier,
Yeah,
as a condition where early detection is really crucial.
it is.
What makes early detection so important in the case of Alzheimer's?
Well, Alzheimer's is a progressive neurodegenerative disease, meaning that it gets worse over time.
Right.
And while there's no cure yet, early detection can give individuals and their families more time to plan for the future.
Okay, so they can make those important decisions while they still have the capacity to do so.
Exactly. They can make decisions about their finances, their living arrangements, their health care, and they can access support services and treatments that can help manage the symptoms and improve their quality of life.
So even though it's a progressive disease, early intervention can still make a big difference.
It can. It really can. And there's growing evidence that lifestyle factors can play a role in delaying the onset or slowing the progression of Alzheimer's.
Oh, that's interesting.
Yeah, things like regular exercise, a healthy diet, cognitive stimulation.
Keeping your brain active.
Exactly. All of those things can help maintain brain health.
That's good to know. So it's not just about accepting the diagnosis. There are things people can do to potentially mitigate the effects.
Absolutely. And early detection gives people the opportunity to make those changes early on.
What are some of the early signs of Alzheimer's that people should be aware of?
Well, memory problems are often the first sign.
Right. That's what we typically associate with Alzheimer's.
Exactly. But it's not just about forgetting things occasionally.
Okay.
It's about those consistent and progressive memory lapses that interfere with daily life.
Okay, so like forgetting important appointments.
Right. Forgetting important appointments, getting lost in familiar places, having trouble following conversations.
Those are some pretty clear signs.
They are. And other early signs can include difficulty with problem solving, poor judgment, changes in mood or personality, and even withdrawal from social activities.
So a wide range of changes that can indicate something's not quite right.
Exactly. And if you notice any of these signs in yourself or a loved one, it's important to consult a healthcare professional for a proper evaluation.
Now, I know there's been a lot of talk about the role of genetics in Alzheimer's.
Yeah.
Can you shed some light on that?
Sure, there are certain genes that have been linked to an increased risk of developing Alzheimer's.
Okay.
But it's important to remember that having these genes doesn't mean you're destined to get the disease.
Okay, so it's not a guarantee.
No, it's not. And many people with these genes never develop Alzheimer's.
So it's one piece of the puzzle.
Exactly. And there are other factors that can influence the risk of developing the disease, like lifestyle choices, environmental factors, and overall health.
So it's a really complex interplay of factors.
It is, and research is ongoing to better understand how these factors interact and how we can prevent or delay the onset of Alzheimer's.
That's encouraging to hear, so it's not all doom and gloom.
No, not at all. There's reason to be hopeful. And the more we learn about Alzheimer's, the better equipped we'll be to address it.
Well, that's a great segue into our next topic, which is this idea of the difficult child and how those behaviors might actually be masking underlying mental health issues.
Okay, yeah, that's a really important topic because children don't always have the ability to articulate what they're feeling.
Right? They might not even understand it themselves.
Exactly. So their emotional distress often comes out in their behavior.
So a child who's acting out or throwing tantrums or withdrawing from others might actually be struggling with something deeper.
Absolutely. And it's crucial for parents and caregivers to recognize that these behaviors are often a cry for help.
So how do we differentiate between typical childhood behavior and something that might signal a mental health concern?
That's the million-dollar question, isn't it?
It is, it is. And it's not always easy to tell the difference.
Right. And I think one key factor is the intensity and the persistence of the behavior.
Okay.
Is this something that's happening more frequently or more intensely than usual? Is it interfering with the child's daily life?
So if it's starting to impact their schoolwork, their relationships, their ability to function at home, that's a red flag.
Exactly. And it's also important to consider the context. Has the child experienced any recent stressors or traumas? A move, a divorce, a death in the family?
So those external factors can play a role in their behavior.
Absolutely. And it's not always easy to tease apart what's normal childhood behavior and what might be a sign of something more serious.
Right.
That's why it's so important to have open communication with the child, observe their behavior carefully, and consult with a healthcare professional if you have any concerns.
So it's about trusting your gut as a parent or caregiver.
Yeah.
If you're worried about a child's behavior, it's better to seek help than to ignore it.
Absolutely. And there are a lot of resources available to help parents and caregivers understand and support their children's mental health.
Like what, for instance?
Well, the child's pediatrician is a good starting point.
Okay.
They can do a basic assessment and make referrals if needed.
Okay.
There are also mental health professionals who specialize in working with children and adolescents.
Right.
And there are many online resources and support groups that can provide information and guidance.
So there's help out there. It's just a matter of finding it.
Exactly. And it's important to remember that early intervention is key.
Yeah, the earlier we address mental health issues, the better.
Absolutely.
Now, this deep dive has been incredibly informative.
Yeah.
We've covered a lot of ground.
We have.
And one of the biggest takeaways for me is this idea of the difficult child and how those behaviors that we might dismiss as just being difficult or challenging could actually be signs of something deeper.
Right. And that's why it's so crucial to approach those behaviors with empathy and understanding.
And to remember that those children aren't trying to be difficult. They're trying to communicate their needs.
Exactly.
Yeah.
And it's our job as adults to listen and to respond in a way that supports their well-being.
Well said. I think that's a perfect note to end this segment on. Thank you so much for sharing your expertise and insights with us.
It's been my pleasure.
And to our listeners, thank you for joining us for this deep dive into the world of early detection and management of mental health conditions.
Thanks for listening.
We'll be back soon with more deep dives into fascinating topics.
See you then.
And you know, it's interesting because we've talked about so many different conditions and all these early warning signs, but I think the big question for a lot of parents and caregivers is how do we actually identify those early signs in children? Especially when those signs might be masked by behaviors that we think of as the child being difficult.
Right. It's a huge challenge, and it's something that comes up all the time.
It does, it does. So how do we know when to be concerned and when to just chalk it up to normal childhood ups and downs?
Well, I think it comes down to looking for those patterns and those changes in behavior.
Okay.
Is the child behaving differently than they used to? Are their behaviors interfering with their daily life, their relationships, their schoolwork, their ability to function at home? Are they expressing thoughts or feelings that are concerning? Those are the things we really need to pay attention to.
So it's not just about the behavior itself, but also how it's impacting the child's overall well-being.
Exactly. And it's also really important to think about the context.
Okay.
Has the child experienced any recent stressors or traumas? Are there changes happening in their family or social environment?
So understanding the child's world, their experiences, and their unique challenges can give us a lot of insight into what might be going on.
Absolutely. And, while some difficult behavior is completely normal in childhood,
Of course.
there are some red flags that should always be taken seriously.
What are some of those?
Well, if a child is expressing thoughts of harming themselves or others, that's a huge red flag. And
Mhm.
similarly, if they're engaging in self-destructive behaviors, things like cutting or substance abuse or an eating disorder, those are serious issues that need professional help right away.
Those are really concerning signs. What about behaviors that aren't as extreme but are still worrisome? What should we be looking for?
Significant changes in sleep or appetite,
Okay.
persistent sadness or withdrawal, extreme anxiety or fear, a sudden drop in school performance, difficulty concentrating, frequent physical complaints like headaches or stomach aches.
It sounds like we need to be paying attention to those changes from their baseline, how they typically behave and what their mood is usually like.
Exactly. And I think it's also really important to trust your gut as a parent or a caregiver.
Yeah.
If you're concerned about a child's behavior, don't hesitate to reach out for professional help. It's always better to be safe than sorry.
I agree. What are some good resources for parents who might be worried about their child's mental health? Where can they go for help?
A good place to start is the child's pediatrician. They can do an initial assessment and make referrals if needed. School counselors can also be a valuable resource. And there are a lot of mental health organizations that provide information support and referrals to qualified professionals, like the National Alliance on Mental Illness, NAMI.
So there is help out there. It's just a matter of knowing where to find it.
Exactly. And I think it's really important to remember that asking for help is a sign of strength, not weakness.
Yeah.
It shows that you care about your child and you're willing to do whatever it takes to support their well-being.
Absolutely. Well, this has been such an insightful conversation, and I think a big takeaway is that early detection is key when it comes to mental health,
It really is.
and that there are things we can all do to support children and adolescents who might be struggling.
Yeah, we all have a role to play in creating a more supportive and understanding environment.
That's a great point, and I think that's a perfect note to end on. So thank you so much for joining me for this deep dive into the early detection and management of mental health conditions. It's been an honor to have you here.
It's been a pleasure. Thanks for having me.
And to our listeners, we hope this episode has given you some valuable insights and resources. Remember, early detection is crucial, and there's no shame in asking for help. Until next time, keep learning, keep exploring, and take care of yourselves and each other.